Welcome to Let's Talk Micro. Hello, everyone. Welcome to another episode of Let's Talk Micro. I hope you had a great week. As always, Let's Talk Micro, it's available on Apple Podcasts, Spotify, Google Podcasts, Amazon Music, Stitcher, TuneIn Radio, Overcast, Pandora. Whenever you listen to your podcast, you can find Let's Talk Micro. I am also on Instagram as Let's Talk Micro, no apostrophe, and on Twitter as Let's Talk Micro 1. So go ahead and follow, subscribe, leave topic suggestions, feedback. I always like to post pictures of organisms there, and I like to give updates as to when the next episode is coming out. So go ahead and check it out. And if you haven't listened to the last episode of Let's Talk Micro, go ahead and do so. I had an interview with Dr. Jingmei Su, who's a stem cell specialist at Weill Medical College at Cornell University in New York. It was a great interview about HIV and a patient that had HIV and leukemia and received a stem cell transplant, and now the patient seems to have been cured from HIV and leukemia. So we talk about HIV, about treatment options for leukemia, about the CCR5 gene, something that most of us might not be aware of. But in patients and on people that do not have this gene, the virus cannot attach. So go ahead and check it out. It is episode 42. So this week's episode is a collaboration between two podcasts. So this time, instead of having a guest, I am actually a guest on another microbiology podcast, which is called The Microbe Moment with the Microbiology. This podcast was ranked in the top 3 microbiology podcasts, and it is hosted by Tess and John. And they are both microbiologists. Tess has a PhD, and John has a master's. So they both work in this field, and they host this podcast, and they talk about microbes, in our daily lives. They like to talk about the history of microbes, and they also talk about the microbe moment, which they say it's an unique moment where microbes change each person's lives for the better. So go ahead and check out their podcast. They are on all podcast platforms, and it is called The Microbe Moment with the Microbiology. So I am featuring their episode this week. So it's going to be on their podcast, and it's going to be on my podcast too. So in this episode, I get interviewed. I talk about my experiences as a medical laboratory scientist, as a teacher, as a supervisor, what I do in my day-to-day when I'm working in the lab, when I'm teaching, what I did as a supervisor, which is a position that I don't hold anymore. And of course, I talk about my microbe moment. So let's go ahead and listen to the interview.
Hello, Microbial Nation, and welcome to another episode of the Microbe Moment. I'm John, and I'm here with a special guest today, Luis Plaza. He is the medical laboratory scientist at Advent Health. He is also the adjunct laboratory instructor at the University of Central Florida, and he is also the host of Let's Talk Microbe, a podcast where clinical microbiology explained in simple terms, which started in May 2021, and it is released weekly. Hello, Lewis, and thank you for coming on to the show.
Hi, Jonathan. Definitely, thank you for having me.
I appreciate you coming on. I can't wait to hear your story. So first off, tell us a little about yourself. What made you want to get involved with microbiology?
Well, I always liked science growing up, and I touched a little bit on when I started my podcast on the intro. So I was in the military for like 8 years total. But when I was getting around year 5, so the discharge was near, and I just wanted a job that I could do on the outside world, the civilian world. This is one issue that people in the military sometimes encounter, that, they have an occupation, and once they get out, their discharge, retire, they cannot perform that occupation outside in the civilian world. So I definitely wanted to go to school. At that point in time, I didn't have my bachelor's or anything. So I wanted to go to school. But at the same time, getting out, I wanted to have a job so I could, have my apartment and stuff like that. So I started looking around, and then I saw they had like all these schools, like X-ray technician, pharmacy technician, And then I saw the laboratory technician, medical laboratory technician program. So they had this program, so you could basically sign up for it. And then while you were going to school, that was your occupation in the military. So that was actually a great time. I mean, you're in the military, you're serving, and then that's your job. You're getting paid to go to school. So at that point in time, once I started taking the classes for the MLT, then once I started taking micro, I mean, I do like all the areas, but definitely, I don't know, it just everything made sense to me. It's just the way that I feel really comfortable. Like you learn, the terms, everything from the media, the organisms. And at the same time, it was so great how sometimes, as a shy person that maybe, you work more of backstage. So that was a great attractive for it that you're focused on your test, and maybe your patients might be, you have your samples and maybe you have to deal with a doctor about results, but that's about it. There's not a lot of customer, service unless you're like in phlebotomy or something. So after I completed that, I started working, and I work at a small facility, but then I knew that my goal was to work in a large lab. So then I decided to look for programs where I could do my bachelor's on medical laboratory sciences. And that's what I did. I went ahead and I finished my time. So after my 8 years, I went to the University of Central Florida and I got my bachelor's in medical laboratory sciences.
That's really cool. I didn't know that you could work in the military after picking classes. So you got to get hands-on experience with that. That's really cool. I know for me, getting my associate's degree, I take anatomy. I was like, okay, this is cool, but there's things I don't get. And then taking microbiology, what really struck me was these things are so small but so complex, and they can do such extraordinary things.
Yes, definitely. I mean, that's also another thing as I was learning more, and it just the way microbes are, and you have them in your skin. Sometimes you see them in food. Like it's always fun when you're with the students and you're doing, as a student, maybe you do like a slide and put some yogurt in it, and you see bacteria. So that's pretty cool. And it's also, how amazing, like how sometimes, we have bacteria that are organisms that are normal flora for us, or they might be normal for animals, like my favorite bacteria, which is Pasteurella, normal flora on cats, dogs. But then, your pet or you get a bite and then it's, it's pathogenic for us. So it's just amazing how we have them living there sometimes in our bodies. They don't do anything, but then they gain access to another site. And that's when they cause trouble.
Right. Especially like some of the skin microbes on humans, like staph. Once they get into a different area, they can cause a little bit of havoc.
Yes, definitely. I mean, a lot of times, a lot of us, we are colonized, by Staph aureus. At some point in time, even if you're not in this field, you have heard about Staph aureus and about, infections, and it just, it's there in our skin, and then we get a cut, and then it gets in. And then, it can cause, a wide variety of diseases. So it's very serious once it gets to a place where it shouldn't be. And another thing about micro that I love, it's just about how it's a mystery. And, you get all these tools, all this. So you have to solve the mystery and find out what the organism is. So it's very hands-on. It's not black and white. There's like a lot of gray involved in it, because you have to use your judgment. You have to know, is this organism pathogenic in this source, or is it normal flora? Just because something is growing on media doesn't mean that it's pathogenic. Like I mentioned, we have bacteria in our skin. So, you do urine cultures, you do cultures from an area of the skin, you're going to get organisms that are just commensal to the area. So you need to know that.
Right. It's just another form of detective work, really. You have to figure out what's going on. And you got to use the skills you have and the tools you have to figure it out.
Exactly.
So you said that you got your bachelor's. Did you have to do like an internship afterwards? And if so, what was that like?
Yes. And just real quick for the audience. So when I mentioned, so what I got in the military, the medical laboratory technician, that's an associate's degree. So it's a 2-year degree. So, and then medical laboratory sciences, there are many programs out there. In my case, I did what is called like a 2-and-2. You get, your first 2 years, you're taking like prerequisites, organic chemistry, microbiology, biology, a little bit of math. So you start taking those, and those actually I was able to take while I was in the military still. So then the last 2 years are 1 year of theory, followed by the 4th year, which is an internship. And that was, that's actually, it's one semester that we did, basically a month in each of the major areas. So it was great. I mean, me being already an MLT, I already knew a little bit of, I had some of the knowledge and I had experience working. But then this program was more comprehensive. Plus, I did my internship at a large hospital. So I got to see a wide variety of tests in all the areas, very comprehensive blood bank, chemistry, hematology. And then, of course, in my internship, the one that I wanted the most was my last rotation. So I had to wait all the way. We started in August and I had to wait until November to finally get to micro. And once I got there, oh my goodness, it was just amazing. Like, before I had done some micro at a smaller facility, but here, it's like so many plates, so many types of agar, so many organisms, from anaerobes, from the ones that I hadn't seen before. It was just, it was so great. It was, for me, that was like the best month in the whole rotation.
Yeah, I know, like, I believe I told you, I worked in a hospital for a year in the microbiology department. And, when you're getting your bachelor's, yeah, you use some agar plates, but once you get into the hospital, you see a bunch of plates that you've never come across before, not to mention a bunch of bugs that you never come across. And it was overwhelming at first, but it was really awesome just to see the diversity going in there.
Yes, definitely. And when you see one thing that basically in school, and I like to tell students this, it's just we in school, we cover, it used to be one semester of micro. So you get your classic organisms. You have your Staph aureus, your Enterococcus, your E. coli, and then you see E. coli, classic E. coli, very nice, flat lactose fermenter. And then when you get to clinicals, you're doing your rotations, you see there are like 4 other different morphologies of E. coli. You're like, they show you a plate, it's a non-fermenter, or it's mucoid, and they're like, what's this? I'm like, you think, well, it's not E. coli. Well, guess what it is? So it's definitely many, you see all the different morphologies. And also something about the rotation, it was a little bit of scary at the same time because, you're being evaluated. So you have to do well. I mean, as long as you come prepared, you'll do fine in it. But then again, sometimes, you might have to deal. Not everyone likes to teach. Even though it's a teaching hospital, or maybe some people, they just don't know how to teach, or they don't, they could be amazing at their job. But when it comes to sitting down and watch someone slowly get something, they might not have the patience. So sometimes, that's a little bit of a challenge if you encounter someone that is teaching you at that point in time. Of course, everyone's very respectful, very professional, but it makes you a little more nervous if that person is just like, watching you and maybe rushing you a little bit, because they don't have the patience to sit there and make sure you slowly get it. But of course, as a student, you have to come prepared. And that's one of the things. I mean, it is a teaching hospital, and it's not like they just, the teachers, they just sit there and they don't do anything else but pay attention to you. I mean, they're working their bench normally, and they have to slow down to teach you. So we also have to be understanding of that as we're going through the rotation.
Right. And they're just trying to do their job, and they're just trying to determine what the results are.
Yes, exactly. And it slows down. It's just, they have to, what they would do in an 8-hour day, they have to do it while stopping and explaining to someone what's going on, have you look at the test, ask you questions. And so it definitely, it slows them down too. Yeah. So
you said you got your bachelor's. Did you go on to further your career afterwards, or your education afterwards?
Yeah, that has been, at first, I think maybe my intention was to just maybe be, get maybe to like a supervisory position in the lab. I mean, I do love reading plates, but I think as time goes by, I'm definitely, getting in deeper into this, and I realized, I love it more and more. So last year I started going back to school, and I'm getting my master's in micro. I think one of my goals is to eventually teach microbiology. So I'm working on that. Hopefully, maybe in a year and change, I will be done with it. I'm working full time, so I take one class at a time. But I'll get there. But yeah, that's the main goal for me right now, is just to teach. But I'm always gonna have some sort of attachment to the lab. I mean, and especially if you're teaching, you need to stay current. So it's always good to maybe, keeping like some sort of per diem job where you can go and still read plates. A lot of times protocols change, we get new drugs. So you have to, keep current with all that stuff. And yes, the textbooks, they're updated, your guidelines are updated, but it's not the same as you seeing it. And, you get that visual, that hand memory. So it's definitely always very helpful to stay up with all the current instrumentation and technology.
Right. Like, first off, it's great to hear that you really want to pass. It sounds like you want to pass your passion along to the next generation or next group of people, which I love to hear that. And also, science is changing so quickly. Like, I remember going to school and for bachelor's, and they say things like, "Oh, next generation sequencing," and then you go into the field and they're like, "No, this is just what it is now. You've already passed like next generation sequencing. It's just current. It's moving so fast."
It is, and I haven't been in this field for that long. I mean, I've been on MLS for, it's going to be 9 years in May, and then I had 3 years as an MLT, but maybe fully involved in micro about 9 years, give or take. So definitely, even in my time, it has changed a lot. I mean, before it was just, we use a very popular instrument, which is called the Vitek. And that was our main method of getting IDs on the organisms. I mean, it's still used for susceptibilities, but definitely there would, basically you got to a point where you knew based on the cards, all the organisms that you could get. So now with MALDI-TOF coming into the picture, we have all this IDs. So it's even more information that we have to, keep current on, researching, is this organism, is this a false ID? Is it for real? So we're definitely seeing all these organisms coming in, and the flow definitely changes as well with MALDI-TOF. I mean, you don't have to wait a day anymore to find out what your organism is. I mean, you can get it in 10 minutes. So that's definitely a plus. You can give organisms that don't need susceptibilities, you get that ID, you're done with them. It helps you rule out stuff. So with technology, a lot of good things have come. I mean, at the same time, some bad things have come as well. I mean, you get the factor of the laziness.
Mm-hmm.
Sometimes, I mean, I think it's just, and I try to reinforce this in students, it's just when you're doing this, especially if you're reading cultures, you need to basically know what you are going to get before you actually get it. I mean, you look at your sample, you look at your organism, you do biochemicals, and you already have an idea of what you're going to get. But nowadays with MALDI-TOF, it's like, well, why do that if I'm going to get the answer? So you get that factor where people are just running them over and over again just to see if they get an ID. And that can be a little bit dangerous if you don't know what you're doing. But overall, it's all the changes are definitely wonderful. And at the end, they end up, helping the patients out. Get their ID faster so they can get their treatment. So that's what it's all about.
Right. So it's been a while. Vertex, yeah, you mentioned a card. I remember it as like using it as antibiotics and susceptibility testing for bacteria. Am I correct?
Yes, Vitek has both. It has cards for both IDs and susceptibilities.
Okay.
Yeah.
And then MALDI-TOF, which I always wanted to use, I never got to, is pretty much you're just incinerating the microbe with a laser, and it's measuring the proteins for identification inside the cell, right?
Yes. So basically, you add a solution that has like a proton
mm-hmm.
to the organism, and then you fire the laser, and then you do like it's mass spec.
Mm-hmm.
So based on that, what the spectrum you get, then it's compared to what's on the database. And that's how you get it. I mean, it works wonderful with pretty much a lot of the organisms. I mean, if your sample is very buccoid, sometimes, too dry or too tiny, you might have some issues.
Mm-hmm.
But overall, you get some pretty good IDs with it. I mean, it cannot differentiate when it gets sometimes, between species like Achromobacter. That's a one that it will always give you two choices when you put Achromobacter on the MALDI-TOF. It will give you between Staphylococcus and denitrificans. And then at that point in time, you have to do an ID. It happens also with like Streptococcus dysgalactiae. So it gives you like a low discrimination between two subspecies.
Mm-hmm.
Yeah, but overall, it's pretty good. It works way better than, I will say. I mean, Vitek is pretty solid too. I mean, unless you set up the wrong car for the organism, and then it gets a little haywire because it will give you an ID, but it's not the right one. And then to a lesser extent the API. I mean, it works nice with the classic ones, but yeah, it's definitely Molotov is it's really good. But the downside is, you need to have a large volume facility because it's very expensive. So you need to justify that cost. So like a smaller hospital is not going to have a Molotov. It's too expensive, and maybe the volume is not going to justify it.
Right. I remember seeing at one point it was like $750,000 or something like that.
Yeah, I believe so. Yeah, it's just so large facilities. Yeah.
So, I mean, you talked about a little bit about working in the laboratory hospital. What's the environment like there?
Well, the environment, it's interesting. It's as far as we definitely, I mean, I work in a very large facility, so we get a lot of micro from other places, other smaller hospitals like sister hospitals. So there's that interaction when we're trying to locate a sample, something hasn't gotten, or there's some sort of, supplies are needed to be exchanged. The hospital might need some, we might need some from them, depending. So that's mainly the interaction between hospitals as far as, especially with the pandemic, a lot of with the supplies and stuff, who has what, and missing samples. As far as, the people, we are as microbiology, I will say that, in the lab, mostly like overall, we stay in touch with all the other areas a lot. And what I mean is, for example, like blood bankers, technologies that do blood bank, it's like a small community and they stay by themselves. I always like to joke that we only see them when there's like free food in the hospital or something. Like they're always in their area. So there's that interaction, but the environment, it varies within shifts. It all depends. A lot of times when I started, and that this has changed a little bit, but when I started on first shift, it was mostly like the older technologists. They've been doing this for 20 plus years. And then maybe one or two young ones out there. And then as you got to the shifts, you get, maybe second shift or third shift, you have more younger people, either like recent grads, they want to make a little more money because they're getting that differential, they're single, they have student loans, maybe they want to travel. So you see more that population, you see them towards the second and third shift. But as far as everyone is pretty much, there's a lot of teamwork because, it's the volume is high. So we all need to help each other. And it's like a normal, everyone talks about their experience and just like everything, we talk about what we do. And then, we share what we do outside of work, let it be like traveling or a good movie or anything. That's one thing, and as far as sometimes, the mood and the way that the people act, sometimes you see maybe people that work on third shift, a lot of times, they always say, like a lot of times they don't like bosses. So they're on third shift because, they're unsupervised. The manager comes in the morning, there's minimal interaction. So they like that. So there's many differences. One thing that I learned, because I have actually worked all three shifts. So I always thought that maybe, like me, my goal was, when I got into micro, it's like, I want to read plates. I want to learn the organisms. I want to do that testing. And because of the size of the place, it took a while to get all the training. So I always thought that everyone on the other shifts, because typically like plate reading is most hospitals is only done on first shift.
Right.
Yeah, maybe a little bit on second and pretty much none on third. So I thought that everyone wanted to learn, that maybe once given the chance, they will jump at it. But that's not the case. A lot of people on off shifts, they don't like reading plates. They don't want to. And you combine that with the fact that sometimes, people that work maybe at night, they have family situations, like they don't get enough sleep. So sometimes, the mood might be different, maybe a little bit grumpy, but overall it's really good people, hardworking. Unfortunately, like in every workspace, sometimes you do have some toxic ones, but that just happens pretty much in every workspace. I mean, so nothing unprofessional, but there's some like a level of toxicity. So if left unchecked, it can tilt the mood of every person in the shift. So that's something that, we have to watch out for.
Right. So I guess like as a lab supervisor, what are some responsibilities that they have?
Well, as a lab supervisor, you can have, it all depends what your capacity as the supervisor you are. For example, if you're in a very large facility, you can have shift supervisors, and then depending on which shift you are on, I mean, the main responsibilities are always scheduling. You do your hires, either your manager, but if your manager does the hiring, then they include you in the process so you can see the candidates and perform interviews. You have to perform training, make sure that you maximize the use of your staff and base it on what the needs of the shift are. So you make sure that everyone is trained properly. So if you're a shift that, like first shift, that it focuses a lot on plate reading, making sure that you have techs that are trained, reading urines, reading wounds, reading respiratory cultures. So it gets so big, the flow, that in large facilities, you can have one area only doing urine cultures, one doing respiratory. So you have to make sure that the technologies are trained so everyone can rotate properly, right? Because, you have to factor out the fact that, there's sickness, the well-deserved vacation time. So if you have, if you only have one tech that, let's say, reads respiratory and then they go on vacation, then you as a supervisor have to step in, because if not, you're in trouble. So you have to make sure that you have that balance. And of course, you have to keep the staff competent. So every year you have to, do the annual competencies, making sure that everything on their training folder is up to date for inspection. You review quality control paperwork. You can also review test results, make sure that all the maintenance checks of the shift were done. Temperature, if the incubators need to be clean, all that stuff. You have all sorts of maintenance. You have daily, you have weekly, you have monthly, quarterly. So you have to make sure that all that stuff, it's done at the proper time and everything is properly documented, because of course, you're going to get inspected at some point. So you have to make sure that all that it's in order. So those duties, even if you're in a small facility, you have to do pretty much all of those. If you're in a large facility where you're maybe like a shift supervisor, then it's mainly, training, competencies, and scheduling and hiring. Yeah, that's about it.
So you said you've been in microbiology for 8 to 9 years. What's the coolest thing that you've seen in the lab?
Well, believe it or not, I mean, it is, I do seen like, some part, I seen like fingers and, when they have done, amputation, of course, from the point of view of the patient, it is very sad. And you always, in an ideal world, you wouldn't see any of this stuff, right? But you do see that, it's a lab. But however, the coolest thing that I seen was when I was rotating, as part of the surgical lab. So they do all those stat testing for patients that are having a surgical procedure.
Mm-hmm.
I got to see a heart surgery.
Oh, wow.
So that was amazing. Like they let us get close enough. I mean, of course, with all your PPE and properly all the procedures and stuff. But so we managed to get close enough. And then, you see the heart, when it was stopped. And then once, they put like a little potassium and then it gets stopped. And then once they wash that, the heart starts beating again. So that was amazing, but not as amazing as the fact that, and I guess, as we get more proficient in our work, I mean, sometimes, a lot of this stuff gets to be like more of like a second nature. So you don't think about it as much. Like, for example, like you were able to, let's say you're reading cultures or doing a testing and you can have a little bit of music playing in the background.
Mm-hmm.
And it's not distracting because, you're proficient enough that you're paying attention on your job, but you have something on the background. So for me, it was so impressive that the doctor was performing the surgery and then he was talking to his coworkers. I remember something along the lines are like, well, yeah, like, we're doing a barbecue this weekend and, it's like, let's go. And after that, we'll walk the dogs. And I'm like, oh my goodness, just concentrate. That's what I was thinking. Here you are talking about a barbecue and you're holding someone's heart. It's just like, so that was mind blowing for me. Like, it's just, oh my goodness, how skilled and proficient, these physicians, are with their training, that it's just, they have this conversation. I mean, you see that on TV, that on the shows, they're operating and they're talking about that stuff, but it was a little bit shocking to see it in real life. How you can do something so serious and at the same time be talking about walking your dogs and doing a barbecue.
It is. It's really mind-blowing. I got to also sit in, like, it wasn't a heart surgery. I think it was like a laparoscopy. But yeah, it's just, you've seen them perform all these and then they're just talking very casual while doing it. And I don't know about you, but I'm like in the corner holding my breath, watching the screen as they're doing it.
Yeah, I was that too. I mean, I was just standing there, and I mean, I got to be in the room, and I remember that it was like a little step stool of sorts that we stepped in, and we got so we could look down and see the heart beating. So that was, yeah, it was very impressive and mind blowing. It was an amazing experience to get to know it, to witness that. And that doesn't really, I mean, it doesn't have to do much with laboratory medicine. I mean, we do run the labs of the patients, but still, it was something very cool to witness.
So I know you're also an adjunct laboratory instructor, and it seems like you do it because you like to pass your knowledge to the next group of people. So my question is, while instructing, students, do you instruct them in the laboratory, in the classroom, or both?
Yes, so I do both. So yes, I'm definitely very, very passionate, and I do want to pass the knowledge. So that's one of the things that led me to this. But yes, it was before, like pre-COVID, it was completely in person.
Mm-hmm.
So it was a little bit challenging in the way, it was like about 30 students. So when you are looking at, if you're doing gram stains and you're looking at every microscope, the time goes by so quick. So at that point in time, I had some volunteer technologists that they will come in and assist me. So that way, we could focus more on the students and they will get more time.
Mm-hmm.
So that was, yeah, like I said, pre-COVID. Then with COVID, it was a little bit completely remote at the beginning. And then now it's split. So basically the class gets split. At one point in time, it was split in 3 groups. And then nowadays it's just in 2 groups. So, but it definitely, I mean, microbiology is just, there's so much information that, I mean, yes, you can read theory online and possibly, do well on your exams, but the lab portion, as far as looking at this plates, a lot of times the pictures, they don't do justice. It's not the same when you're looking at a plate crowded with organisms and, get that feel for it, get the feel of the microscope. So that has been challenging for the students. You can notice that you have to slow down the pace a little bit, before you could go full steam ahead and do more work, but you have to slow down so they can start getting the basics again. And because if you're learning about gram stains online, yeah, you can get the theory down, but it's not the same, that trial and error where you can make 10 slides and maybe not all 10 you're going to stain the same. So it's a lot of hands-on. So that's one of the challenges of online learning for the students. That has been like one of the challenges. Also, that by splitting the groups, they probably get less information because you have to repeat. You get, instead of, let's say, getting 16 weeks, so each group gets 8 weeks. So if they're not seeing it, like microbiology, it's all about repetition. So if they're not seeing it constantly, like I tell them, you learn about gram stains and then you come back 2 weeks later and you forgot half of what you learned because you haven't been exposed to it. So that makes it a little bit difficult. Hopefully one day we can get back to having that full-size classroom, and that way we can push through all the material.
Gram stain is a perfect example because, textbooks, it's 30 seconds to a minute, crystal violet wash, 30, 60 seconds with iodine, decolorize for 5, and then safranin for up to a minute. But, you can say that, but those 5 seconds of decolorizing, like, it can end up being too much or too little. And you either under decolorize or over decolorize the sample, and now it's not exactly what it's supposed to be. I mean, I've done that plenty of times.
Exactly. Yeah. So just, it all depends, maybe, you can have a thicker smear, a thinner smear. So sometimes, the result is not going to be the same. So yeah, you definitely need a lot of practice. And like you said, sometimes, some laboratories might use a stronger decolorizer, or, it says, like put decolorize for like the 3 to 5 seconds, but sometimes, maybe it works better if you hold the slide and add the drops. Or sometimes, a technique that I use too is just, you add the decolorizer and then just leave it on the slide for 3 to 5 seconds. So there's definitely, even with all those techniques, yeah, I might get one perfect slide and then maybe another one that's not as great. So it takes a lot of time. Like I like to tell students, you don't become a microbiologist overnight. This is just constant repetition. You do it day in, day out until you get comfortable enough that and you keep adding to that. So definitely the most important thing is just to have that hands-on experience. There's nothing like that.
I think that's an important thing to bestow on students too, because I feel like, at least in my education, that was kind of lost. It's something that's so invaluable once you get out into the real world, like to have the physical skill instead of the theory behind it and the repetition. You know how to do it. You are proficient at it.
Yes, and you can even see it that sometimes you can have bright student that knows all the theory, and then they ace their top of their class, they ace their exams, they ace their certification, and then once they get to the lab and they look at the plates, they're like, oh, what? It's like, what is this? Or when it comes to time to make that judgment, it's like, do I mix this? Do I work? What do I do with this plate? Is it like I mentioned earlier? It's just there's sometimes a lot of gray involved that you have to use your judgment and make some decisions, based on what you have, or something. You cannot be working a culture for 7 or 8 days. That's not good for the patient. So we definitely have to try to get it out as soon as we can. And that comes with knowledge and experience. So it's not the same. Even if you're, 4.0 GPA and, the best of the best, you need to learn that hands-on, and it's gonna be you're gonna feel challenged when you get to the lab and you're looking at those plates or you're doing that test. And I've seen it a lot of students like that sometimes.
So, to end this little section, what advice would you give someone who would be interested in becoming a clinical lab scientist or a medical lab technician?
Yeah, so if you are interested in this, I will say that definitely. Well, one thing is, one of the challenges of this profession right now, I mean, there's a lot of demand. And optimally, it will be good to have more resources where we can have, when you go to a program, you have multiple classes running at the same time. I mean, unfortunately, there's not a lot of resources for that. So typically a program has about 2 classes going in. So you have your juniors, right? So they're just getting started. And then you have your seniors who are doing the rotations. And each group, depending on the facility, might have maybe 30 students at the most. So basically, every year, 30 people in that particular school get the chance to study for this. So my advice is, it's a great job. There's always going to be work for us. Unfortunately, we all get sick, we have injuries, infections. So wherever you go, especially, here in the States, there's high demand everywhere. So you have that job security. But what I like to say, the students, is like, don't use it as a stepping stone. I mean, it's just try to, if you're doing this, work in it, try different areas of the lab to see what you like. Not everyone likes micro. A lot of techs that work, let's say, in hematology or chemistry, they say, I don't like the smell. Micro it always smells in there. So I'm not going there. So find out what you like. I mean, sometimes you might be proficient in hematology. You might like working with instruments, like in chemistry, doing that kind of work. So if you do the program, give yourself the chance to work in it, rotate around the areas to find out which one you like most. But don't use it because you want it to look good for your med school application. If you want to be a physician assistant, that's one slot that maybe you want to be a doctor, and then you get that spot because, you have excellent grades and everything looks good. But then after a year or so, you're gone. And maybe someone that doesn't want to be a physician and this is what they wanted to do, they couldn't get in, maybe because the grades were lower than the student that wanted to be a physician. And of course, there's nothing wrong with that. If we progress, and sometimes, we work in the lab and then we decide maybe it's not for us and we move on, become physicians. I've seen going to nursing. So, and that's fine. Just make sure that there are not that many slots yearly. So just give yourself the chance to work in it and see what you like.
I think that's some great advice. So we haven't reached it yet, but of course you also have a podcast called Let's Talk Microbe. Can you tell us a little bit more about it and what inspired you to start it?
One of the challenges in my career has always been that I always want to learn more. And it's always difficult. I mean, we're in a serious need of mentors. We don't have that many mentors out there. I think a lot of times, unfortunately, it seems, I will guess, somewhat threatening if you want to learn a lot. maybe it might be seen as, well, if this person wants to learn everything, maybe one day they will try for my job. I mean, I don't know. That's just me thinking out loud. So that's one of the challenges. And sometimes, there's not a lot of, yes, there's enough for where you learn enough to get proficient at your job, but we definitely need to know more. I mean, just like antibiotics, intrinsic resistance, stuff like that. We get this request from doctors, and sometimes, techs will just perform it when the organism is intrinsically resistant to it. So it's just, you're wasting supplies. And that's where the need for information comes in. You need to get familiar with all your resources. You have your CLSI with your breakpoints. You have your American Society for Microbiology guidelines that it tells you, organisms, what do you suspect, based on the source. So there's that need for information is there. It's not that, we don't all want to be managers or we don't want to be directors, and I'm definitely not a doctor. So it's just, I want the tools so I can do my job better. That way, if I'm well informed, when I get a request like that, it's like I can talk to the physician and say, hey, sir, we don't need to perform this request because, this organism is resistant to this antibiotic. And then we don't waste supplies and time that we could actually be using it to help another patient. So that's where the podcast came in. I'm definitely a teacher in nature. I like to, if I know something, I want to teach it to someone else to make sure that they're good at their job too, that they become more proficient. So I decided to make the podcast to bring the information to one place and also put it in simpler terms while sharing my day-to-day experiences in the lab. What media works best, what have I done when I'm out of a particular agar, for an organism. So things like that. And I just, like I said, put it in simpler terms. There's a lot of information out there. And then once you get, you can get very technical, especially when you're talking about things like, like gene sequencing and terms like that, it gets, definitely very technical. So I just want to put it in words that a microbiologist and a student, both can actually understand what I'm trying to say and have it there. So the podcast, I'm just going through all the organisms slowly, covering testing, what media they grow on. And at the same time, if I see an article that is helpful for the lab, I talk to the authors and invite them to come into the podcast so they can talk about it. That way there's that awareness, that maybe there's a new drug out there, there's a new organism, stuff like that.
Yes, I think you hit upon another point. It's not just microbiology, but I guess science in general can be very technical, and there is a disconnect between the professionals and people that are trying to learn about it. It can get very confusing. So it is very important to phrase it in a way where people can understand. And that's a very important service that you're providing to the public. It's like, okay, here's this technique and this is what this means, or this is some new science and this is what it means.
Yeah, exactly. And at the same time, of course, like I mentioned, there's a lot of information, but sometimes, we're busy with our lives, just like everyone, in the lab, a lot of techs, they're sometimes, they're moms, that they just, they drop their kids in the morning, either daycare or school. And then once they leave the lab, you have homework, you have all the life stuff. So a lot of times, we don't all have time to either start looking through journals or finding out that stuff. But however, it's very easy where you're working out, you're making dinner, you're doing whatever, you put the podcast on your phone and just put it in the background and listen to it. Or if you have a commute, a 20-minute episode, just put it there. Oh, you learn something while you're in a place that you have nowhere to go, like in a car. So it's very nice and convenient. So that's one of the goals. It's there, they're learning about it. And then if they want to learn more, then of course, you can always take the initiative and then either maybe talk to your physician that you have or your director, or go and look at the resources, because I do mention them in my podcast, where I find the articles, what kind of resources I use when I'm talking about the organisms. So I put them out there. And these are the same resources that you will find in your lab. It's like, why a certain culture has this media and that media and that media. It's like, well, it's on the microbiology handbook for the American Society for Microbiology is listed there. And guess what? Those binders, they're in the office somewhere in the lab. So it's the same information that it's in your lab that I'm putting up there too.
So what has your experience been so far making this podcast?
It is time consuming, but it is good. It is relaxing for me, for a lack of a better word, I guess. It's like therapeutic for me. I sit down and doing the research, and at the same time, along the way, encountering all these wonderful people, which have been so great. I mean, so far, and I have more interviews coming. But a lot of this, physicians and microbiologists, PhDs, they've been great. So you send them an email, well, would you like to come in? And they agree. So it's been amazing. I don't know. Normally, I don't think I will be connecting with this many people. So to be able to talk to microbiologists, let's say from another country or from another part of the country. I had some doctors from the Mayo Clinic. I had another one from Maryland. So connecting with all these people, has been great. Finding out what they do in their labs or what kind of research they're coming with as far as with organisms and susceptibilities. So it's like I said, it's time consuming, but it's definitely worth it.
I think my favorite aspects about doing our podcast is, talking to different people and getting to see why they're excited about microbiology. I always like to hear the stories behind people. I think that's really cool. And also, like you said, in researching for this podcast, a couple weeks ago, I found that they're recently categorized bacteria that's 2 centimeters long and you can see with the naked eye. And that blew my mind.
I saw that. Yeah, I saw that on someone shared on Twitter. And it's definitely, one thing has been, there are so many people out there, especially taking advantage of social media, and they're sharing their knowledge, they're sharing what they're seeing. So it's been great. I found so many resources and from all different parts of the world that you see, everyone sharing their information. So it's definitely good. Yes. Connecting with passionate people. And that's also another thing that passion is what brought me to teaching and also for the podcast, because it is not everyone is like that. Yes, everyone is. I had the fortune that, like the technologies that I work alongside, very proficient, very knowledgeable. So they're excellent at their job. So, have been a great resource for learning and stuff. But sometimes, that passion is not there. I mean, we're all different. Sometimes, some of us, they like to do their job and then go home, and I don't know, in my case, it just kind of follows me after work. So I think about this stuff outside of work, and finding people like that as well, has been great. Only maybe a handful of techs that I met along the way, they are micro nerds like me, and they like to talk about this stuff and this at this level. With technology and social media and connecting with all these people and finding out they're like that, they want to make everyone more proficient at their jobs and sharing their knowledge. So it's been great. Yeah.
So before we go, I want to ask you, what is your micro moment? Like, what inspired you, or what did you find out about microbiology that really blew your mind?
I think my micro moment has been, it's just how these organisms, how sometimes, they're so different, and how it blew my mind how sometimes, some grow in a certain media and some don't, or maybe some type of agar that is not intended for them, and they do grow on them. So that's how that, has been very mind blowing as when I got started and as I seen it. But at the same time, it's definitely helped me, because that way you start learning about all this agar and the antibiotics, and you can get some organisms. It comes in handy when you're trying to isolate an organism. I had in my career, there was a great time where there was a Stenotrophomonas that it was very hard to isolate. And thinking about what I know and what I have learned, I'm like, let's go. I look at the susceptibility pattern, because it was growing alongside another organism, and I look at the other organism, and then I said, well, let's go ahead and put a meropenem disc, because the other organism is susceptible, but steno is intrinsically resistant. So that was done, and then you could see like the inhibition from the first organism, but then growing close to the disc, there it was, that steno. So we managed to get it out, and then, do susceptibilities. And that was a great day. Basically, it's that the other organism was growing so large, the steno was underneath it. So, and then the problem with gram-negative rods, especially either like non-fermenters or enterobacteriales, they both grow in blood. Most of them grow in McConkey. They will grow in chocolate. So every time you grab that organism, it's not like maybe you have, let's say that you're trying to isolate a Staph aureus or use a PEA or 2 gram negative rods and you put them on a McConkey. So both of them will grow. So when we're trying to sub it out, isolate that second organism, the first one kept growing, and as we know, Stenotrophomonas is a very significant organism. The level of intrinsic resistance is very high. Plus, it lacks the hospital equipment. It's big in nosocomial infections. So it's a very serious bug. You want to make sure that if you have that organism, you need to isolate it and you need to do susceptibilities to make sure it's not multi-drug resistant.
Right.
Yeah, so that's definitely one that you don't want to be. You don't want any of them to be multi-drug resistant. But with this one, the choices are very limited. So you have to make sure that you isolate it. So then based on that, if you know what the intrinsic resistance is, then you can go ahead and compare that susceptibility to the other organism and then use that antibiotic. Because of course, if the first one is susceptible to that particular drug, then you will manage to get a little bit of isolation for that second bug.
Yeah, that's really smart. It's a really cool way to figure out that problem.
And that's also another thing, as I've been working on this podcast, and doing more research. And of course, because I have to prepare for, even if you have the knowledge, it's not the same as having it in your head as putting it on a 20-minute episode. You want to make sure that what you put out there is accurate. So you have to read textbooks and make sure that everything is worded correctly so you don't put any false information out there. So while I've been doing this, it definitely has helped increase my knowledge. But yeah, that kind of thinking, it should be around more, because sometimes, we can fall into the routine of, we cannot isolate it. So we try 2 or 3 times, and in microbiology, everything is about time. You already use subculture an organism, it's going to take you 18 to 24 hours. So that's a day right there. So, and then if you don't get it, you try again, that's 2 days. So this, having that type of thinking, it's definitely very helpful. And that's also one thing that I'm trying to achieve with the podcast, put all my little quote unquote tricks out there. And it's just, nothing special, just things that I have noticed over the years.
Yeah, time is very important, especially in the hospital. If someone's sick, you need to make sure that they're getting the proper treatment before they go septic, or if they go septic, in order to treat the infection before, it's too late.
Yes, exactly. And yeah, because, let's say that they get put on some sort of, broad spectrum antibiotic, and they can be like nephrotoxic, and then 3 days in, you find out that the organism are resistant. So they have to change the drug again. And all these factors, they contribute to the antimicrobial resistance. And at the same time, the most important thing that it's just like the time is running for the patient. So you want to make sure that as soon as possible, you put that patient on the right drug so that organism can be properly treated.
Well, thank you for coming on, Louis. Where can people find you?
I am on Instagram as Let's Talk Micro, no apostrophe. And then I'm on Twitter as Let's Talk Micro 1. And the link to my podcast is in both Twitter and Instagram. You can just type Let's Talk Micro. And I am on all the platforms. So there's no mistaking it. There's a little picture of the bacteria talking to each other, the cocci and the gram-negative rods. Consistently, I do release episodes every Thursday night. If I'm not able to actually release one, I'll let the audience know ahead of time that I'm taking a break. I'm pretty much every Thursday.
Well, I can't wait to hear your next episode. And thank you again.
Hey, thank you for having me. It's a great experience. When I started working on this, I remember searching for microbiology podcasts and I saw yours. And I started listening to some episodes and I saw that your podcast has quite the, on social media, you see everyone, it has even been voted as one of the best podcasts. It's amazing that, you have given me the opportunity to actually be talking in here. I didn't think this will happen, but it's been great. And I just want to say something real quick, because it's always good for a disclaimer sort of thing, and I said this before, but, like UCF or Advent Health, they have no affiliation with me. They are my employers. Yes, but they have nothing to do with this podcast. So I always like to say that. so everyone is aware of this.
Yeah, it's always important to put those little disclaimers in there, especially like if we do something a little medical heavy. I always try to say, like always check with your doctor. Don't go exactly with what we're saying. But I really enjoyed having you on this, and you have great stuff in your episode, and I think people really should go check it out.
To the audience out there, yeah, go ahead and check it out. I say on the podcast, if you have any suggestions, anything that, a particular topic, you can always suggest it and I will keep it in consideration when I'm working on episodes. But yeah, definitely check it out. Every day, staying consistent. And I appreciate the support of all the listeners out there that take the time to download an episode. So if you listen to it, just let another coworker. If you're a student going through the program, it's a great resource. That way, if you need to reinforce something, sometimes, we look at procedures, we read manuals, and it doesn't make sense until someone talks about them. And you're like, oh, okay, that's what this means. It happens all the time. So it's a great tool to keep it in hand when you are reading that book. And maybe you have a question about the test, and then there it is on the episode with the reactions and how it goes. So you can start getting that visual of, about how that test works or how that organism behaves or what media it grows on, all that stuff.
Indeed. Thank you again, Louis.
All right. Thank you so much. And that, my dear audience, is the end of this episode. I hope you enjoyed listening to the interview. I definitely enjoyed being on the Microbe Moment with the Microbiology podcast. It was a privilege, actually. They're a very popular podcast, and the fact that I got to collaborate with them is pretty cool. So once again, thank you, John and Tess, for having me on. And if you want to check out their podcast, go ahead and do so. They're on all the podcast platforms. So just search the Microbe Moment with the Microbiology. And they are actually also on Twitter, and they're on, on Instagram. So go ahead and check them out. As always, continue bringing passion to what you do. Stay motivated, stay safe, and of course, continue talking micro. Until the next time, bye.